The International Society of Oral Care. Introduction. The Japanese Society of Oral Care, JSOC, is a leading professional organization in the medical and dental field with its history over 30 years. In April 2020, in order to build an integrated multidisciplinary healthcare platform in advancing global oral healthcare, the JSOC has established the International Society of Oral Care, ISOC. ISOC welcomes healthcare professionals, educators, and researchers with innovative insights in strengthening oral care in a global scale. The ISOC initiation aligns with global strategy and action plans, such as Decade of Healthy Aging, the Sustainable Development Goals, and the Universal Health Coverage. We would like to introduce the societies that collaborate with ISOC. The Japan Society of Clinical Oncology, the Japanese Society of Cancer Nursing, the Japanese Society of Palliative Medicine, the Japanese Society of Home Care Medicine, the Japanese Society of Anesthesiologists, the Japanese Society of Oral Medicine, the Japanese Society of Medical Oncology, the Japanese Society of Pharmaceutical Oncology, the Japanese Society of Medical Mycology, the Nippon Pharmacy Association, the Japan Society for Transplantation, the Japanese Respiratory Society, the Japanese Society for Dialysis Therapy. Your oral health is more important than you might realize. A good oral health allows us to speak, to smile, to smell, to swallow, to chew, to taste, and to show feelings and emotions, all of which are related to the quality of life. Some of the most common oral diseases. 1. Untreated dental caries in permanent teeth is the most common health condition according to the Global Burden of Disease Study 2017. More than 530 million children suffer from dental caries of primary teeth. Number 2. A severe periodontal disease which may result in tooth loss is also very common, with almost 10% of the global population is affected. Number 3. Oral cancer is one of the 3 most common cancers in some countries of Asia and the Pacific. Oral conditions are frequently considered separate from other chronic conditions, but these are actually interrelated. Non-communicable diseases, also known as chronic diseases, are one of the major challenges for health and sustainable human development. According to World Health Organization, cardiovascular diseases account for most NCD deaths, followed by cancers, respiratory diseases, and diabetes. Oral diseases share many common risk factors with NCDs, thus close collaboration between physicians and dentists is necessary. Including population growth and aging, due to demographic changes, the cumulative burden of oral conditions dramatically increased. Globally, the number of people with untreated oral conditions rose from 2.5 up to 3.5 billion. In the past, dental epidemiologists have been attempting to quantify global dental disease prevalence, but it has been nearly impossible. This changed in 2013 when the very first paper estimating global oral disease burden generated from the Global Burden of Disease study. As countries continue to develop, the prevalence of NCDs, including oral diseases, will likely to rise. And therefore, the contribution of oral disorders to the global total daily burden will increase as well. Socio-demographic index is a summary measure that identifies where countries or other geographic areas sit on the spectrum of development. Expressed on a scale of 0 to 1, it's a composite average of the rankings of the incomes per capita, average educational attainment, and fertility rates of all areas in the GBD study. And extreme oral health inequalities exist for the most marginalized and socially excluded groups, in particular people with low socioeconomic status. Inequalities in health arise from the unequal distribution of power, income, goods, and services, whether it's globally or nationally. Oral health inequalities are caused by the broad conditions in which people are born, grow, live, work, and age. Researchers aim to highlight the urgent need to address oral diseases as a global health priority by describing the scope and consequences of oral diseases, the social and commercial determinants, and ongoing neglect in global health policy.